I made a promise. Primum non nocere. This is Latin, and it means, first and foremost, I will do no harm. This is a promise made by countless young physicians across the globe and across the centuries. It is a promise that I made solemnly and with great conviction. Now I have had to reconsider what this promise really means. What is someone to do if taking no action results in harm? I believe I am in that situation right now, and that is why I am speaking up today. You see, the idea of doing no harm is only one of two pillars that form the foundation of ethical medical practice. The other is called informed consent. This is what distinguishes a surgeon and her scalpel from a thug and his dagger when they plunge their knife into the flesh of another human being. The surgeon intends to heal, the thug to maim. The doctor asks for permission first, and the criminal does not. All of our brothers and sisters out there who have accepted a vaccine, I believe, have done so voluntarily. But have they been appropriately informed? I say no. Even today, people still do not realize, as we've been saying today, that these vaccines have not been FDA approved. They've received emergency use authorization, and there are three stipulations for emergency use. Do we know what they are? Number one, we must be in an emergency. Are we? Hold on a second. 500,000 people or more have died from this dreaded disease. On the other hand, from the CDC's own data, if you are under the age of 74, you have a 99.9% chance or better of surviving it with no treatment. Who is right? There is no right answer, my friends. This is an opinion. It is not codified in any statute. It is not written into law. It is an opinion. But how you respond to this question completely determines how you will feel about the next questions I'm about to ask. The second stipulation for emergency use authorization is this: the vaccines must be at least 50% efficacious. What does that mean? That means if you get the vaccine, you have a 50% chance or less of getting COVID-19. Are they that effective? Well, Pfizer and Moderna both suggest that their vaccines are 95% efficacious. 95%. This is astounding, if not incredible, and I mean that literally, not to be believed. How? Why am I saying that? We must consider what this number means in the context of the history of vaccinations. In this country, every year, we engage in an enormous campaign of vaccination. The best we have ever done is 60 to 70% efficacy of flu vaccines. That's the best we've ever done. On average, we fall below 50, and on some years, it's much worse than that. How did Pfizer, for example, how did they get it so right? So quickly, on the first shot, no pun intended. In order to answer that question, we must look beyond the headlines and actually look at the studies. How do you do a vaccine trial? How do you do it? Very easy. Pfizer got together 38,000 people and they gave half the people the vaccine and half the people the placebo. And what did they do next? They waited. What did they wait for? They waited for people to come down with COVID so that they could measure how many people got COVID who got the vaccine compared to those who got the placebo. And you know what they found? They found that there were 19 times, 20 times more people who got the placebo who got sick than got their vaccine. That is, in fact, 95% efficacious. There is nothing wrong with the math. But we must look closer. How many people got COVID in that study after 4 weeks? 170. Based on the outcome of 170 people, they've been authorized to deploy their vaccines to over 100 million people. Is this prudent? It depends. There is no right answer. It depends on how big an emergency you think we're in. Do you see what I'm saying now? What is not generally known is that in the same study, while they were waiting, this is the goal of the study, is the people who get sick. That's how they make their determination, right? Does everyone understand that? There were 3,400 people or more that came down with COVID-like symptoms. Most of them, in a ratio of 9 to 8, got the placebo. You understand that we're talking about a much bigger pool of people. These people with COVID-19 symptoms tested negative by PCR. What do you think Pfizer did? Did they retest them just to make sure? We do not know, and if they did not tell us what they found. Did they make sure by doing another test, let's say an antibody titer, to see if these people were actually exposed to the SARS-CoV-2 virus, to confirm whether or not they had the disease? We do not know. And if they did, they didn't tell us what they found. My question to you is this: why would a multi-billion-dollar pharmaceutical industry and vaccine manufacturer choose not to look further once they have already attained emergency use authorization from the 170 people? It is a question. The last stipulation for emergency use is that there must be no alternative to a vaccine. Is there an alternative to a vaccine?
HCQ!
Wait a minute, an alternative to a vaccine? Wait a minute. Is there a medicine you think that you can take that may prevent you from getting COVID-19? A medicine? There is. As a matter of fact, there are. There is a medicine called ivermectin, which has been demonstrated. Ivermectin! This medicine has been demonstrated in multiple randomized controlled trials and case series across the globe to have 80 to 85% efficacy in preventing COVID-19. There is a group of organized critical care physicians that have been pleading with the CDC to revise their guidelines to include ivermectin. Have they revised their guidelines? No. Have they impaneled an investigatory committee to examine the evidence behind ivermectin? No, they have not. Another question for you. Why would the CDC, the Center for Disease and Control and Prevention, choose not to look at the evidence behind an alternative therapy to vaccines? Why? I am not a virologist. I am not an epidemiologist. I am an anesthesiologist. I am not an expert on these matters, which is why, it seems, I have nothing but questions and no answers for you. But when you look beyond the headlines and look deeply into the situation, that's what you find. You do not find answers, you find questions and more questions. For those of you who do not know what anesthesiologists do, it is perhaps best summed like this. Anesthesia is the practice of medicine that is 99% pure boredom mixed with 1% sheer terror. What does that mean? That means in an operating room where I practice medicine, most of the time things go really well. But when they go badly quickly, and they go badly very badly. How does a young anesthesiologist prepare themselves for such situations? Perhaps the best advice I ever got came from a former residency director, not so far from here at the University of Pennsylvania in Philadelphia. He said to me this, he said, Madhava, when you get called into that situation, don't just do something, stand there. He didn't say don't just stand there, do something. He said don't just do something, stand there. What did he mean by that? He meant, he was pointing out something very important about the medical field, which is this. Often the greatest risk to our people, to our patients, comes when well-intending caregivers are forced to make assumptions, and then they act, and then they have forgotten that they made assumptions to begin with. He was asking me to stop, observe, make your assumptions, act, but then reassess. What assumptions have you made? This pandemic and our response to it is based on some huge assumptions. Huge. But that is not what we're being told. We are being told that the science is settled, that there is only one option. The science is not settled. And my friends, having but one option is not having an option at all. So for my brothers and sisters who believe that if we just get the jab, things will get back to normal. Perhaps you're right, but not if this vaccine is mandated. You understand what I'm saying here? Because sooner or later, there is going to be another mandate that you may not agree with, and you will have no leg to stand on because of the precedent that we may be setting here today. None. This rally is about health freedom, but it is also about health, and perhaps most importantly, it is about freedom. Requiring a person in a free society to receive a yet-to-be-proven therapy in order to work, travel, or attend a venerated institution like Rutgers University negates the idea of what a free society is. You understand what I'm saying here? That is no different than throwing someone into prison and suggesting that they're still free to move around their jail cell. That is what's happening here. What we do right now is going to be extremely important, not just for our generation, but our children's generation and their children. And for that reason, I have two requests of you. The first is this: please do not attempt to seek a personal exemption from a vaccine. This is not something that we can sidestep individually. It is something that we must confront and oppose together. And lastly, or secondly, there is an enormous amount of uncertainty and fear here. We must acknowledge that. And because there is so much fear, some of that is justified, much of it is not. But if we do not acknowledge the fear with compassion, we're making a grave mistake. I urge you to share what you know with compassion and not be dismissive. Using words like sheep or asleep to denigrate those who disagree with us is a monumental mistake. We need each other. This is a time where we need to come together. There is disinformation on both sides of this debate, and that disinformation is being used to separate us at a time where we need to unite. We are being called to hold our position with kindness and with the depth of resolve that can only be born of knowing what is truly at stake. Thank you.